Hey guys, Rishi Desai here. I'm the Chief Medical Officer here at Osmosis. Today I'm going to talk about kind of 3 tips to avoid burnout, which is super common. Number 1 tip, make sure that you're using what I call hacks. So there's lots and lots of hacks to get around the bureaucracy of medicine. That's something that exists really everywhere I've visited. Kind of a number of countries around the world all have the same problem of paperwork, right? So make sure you come up with some hacks. Some specific ones that I've used are, in some hospitals that I've worked in where I've been really, really fortunate, you can get a medical scribe, someone to actually scribe what you're writing as you're kind of speaking to a patient. That helps a lot. And if you're interviewing at a place, just ask about that, because the more people ask about it, the more hospitals are going to invest in that. So it's always helpful to have someone else doing the writing for you. If you're not able to have that, or if that's not a setup that's going to happen at your hospital, no worries. I've been in plenty of situations where that's not possible. And there, another hack that I've used is using templates. So I'll have my notes in a template, and I basically will use the same template for that complaint. So I have a template that's set up in my computer for chest pain, another template for diarrhea, another template for asthma. And so just have those templates set up, and so that when you see those patients, you can just kind of knock those notes out really easy. Also kind of triggers your memory to ask certain questions, right? So that's the idea. Like, make sure you have that little hack ready so that you're not spending all your time doing paperwork. So I have a couple notes here. Another thing I like to do is bundle my work. So again, this is still tip number 1 around how to get around the bureaucracy. Bundling work means do all your notes at once. Make sure you do all your discharges at once. Make sure that you, if you have like 4 things to kind of run by the pharmacy, do all that at once. So make sure that you have all your tasks kind of figured out, so all right, I'm going to the pharmacy, let me take care of these 3 different patients all at once. Or if I'm discharging, do 2 discharges together, so you're kind of like on a roll on that. So that's the kind of bundling that I found very helpful. Tip number 2 would be to make sure that you set up your personal boundaries, right? So you want to make sure that you have a specific time when you leave the hospital. For me, that was a very specific 5 p.m. I signed out my patients. I had no problem doing that. I would make sure that I had all my kind of things tucked at 5 o'clock, almost as if like you have an event to go to, or you have to pick up someone, or you have a meeting to go to. Just really firm limits in terms of what time you get out of the hospital, and really hold yourself to that. Like, I got to get out at 5, and don't linger. And so creating really firm limits about when you get into the hospital, but also when you get out of the hospital, really helped a lot. So setting really solid boundaries helped with my burnout and stress level, because I had something to look forward to. I had an end time. I wasn't just kind of always in the hospital. And tip number 3 is make sure you have a really solid work-life balance. So the part of that often kind of suffers is the life. So make sure that you're doing things that you enjoy doing. So even in the middle of the hardest part of residency, I at least found time to read half a page of a book that I liked. Just always do that. That's so important, because the moment you stop doing that is when you start getting really frustrated and you start kind of taking that out on people. So try to make sure that there's little things that you're doing that really kind of save your sanity. For me, sometimes that would be taking a long walk outside. If I know I've got 10 extra minutes, I would just take a little walk outside, or talking to friends. I would make a habit of calling my friends right after I've had a really stressful kind of shift. And I would just go through the list. If they're busy, I would just call the next one and the next one. So just kind of creating these little habits for yourself so that you have something to look forward to outside of just being in the hospital. So again, tip number 1, come up with like kind of bureaucratic hacks so that you're not always feeling inundated with work. For me, that was relying on medical scribes when that was available. More often, they weren't available, of course. And so then using templates, making sure that I bundle my work. Tip number 2, making sure you set firm limits on getting out of the hospital. I rarely would see people accomplish that, so it's a really hard thing to do. And so just make sure that you're on top of it. You're getting out every single day at the same time. And tip number 3, make sure you have a really, really awesome kind of work-life balance, that there's something in your life that you're looking forward to. And it doesn't have to be amazing. You don't have to go out all the time or party all the time or whatever, but really just even little things that you really care about, that you're taking advantage of doing those on a regular basis. So those are the things that help me get through the stressful times. And of course, talking to friends and decompressing. Till next time, take care, guys. Bye-bye.
Start your free trial today at osmosis.org.